Pharmacology, cardiovascular, anti-hypertensive. Many different medication classifications are used to treat hypertension. It is important to understand the different mechanisms of action for different classes of antihypertensives because patients are often on a combination of medications that work synergistically to manage blood pressure. These medications are also discussed in the autonomic nervous system. Clonidine is an alpha-2 agonist. Mechanism of action. Clonidine stimulates the alpha-adrenergic receptors, resulting in vasodilation and decreased blood pressure after decreasing peripheral resistance, increased blood flow to the kidneys, and decreased afterload. Indications. Clonidine is used to treat hypertension and ADHD. Considerations. Monitor blood pressure and pulse rate. Doses is usually adjusted to patient's blood pressure because it can cause hypotension, bradycardia, and sedation. Rebound hypertension may occur if stopped abruptly. Patient education. Patients should be compliant with medication therapy and take the medication at the same time each day. They should be careful not to take more than the prescribed dose within a 24-hour period. Do not abruptly cease medication as rebound hypertension might occur. Medications may cause orthostatic changes, so individuals should change position slowly. Additionally, medications may cause dry mouth and dry eyes. Individuals should also avoid the use of alcohol and other CNS depressants while taking these medications. Beta-1 antagonist. Metoprolol is a selective beta-1 blocker. Mechanism of action. Metoprolol primarily blocks beta-1 receptors in the heart, causing decreased heart rate and decreased blood pressure. However, higher doses can also block beta-2 receptors in the lungs, causing bronchoconstriction. Indications. Metoprolol is commonly used to treat high blood pressure, chest pain due to poor blood flow to the heart, and several heart conditions involving an abnormally fast heart rate. It is used as an early intervention during myocardial infarction to reduce workload of the heart. Considerations. ER formulations should not be crushed. Assess patient's apical pulse rate before administering. If it is less than 60 beats per minute, withhold the drug and call the prescriber immediately, unless other parameters are provided. In diabetic patients, monitor glucose level closely because the drug masks common signs and symptoms of hypoglycemia. Adverse effects. The most serious potential adverse effects are shortness of breath, bradycardia, and worsening heart failure. Other adverse effects include fatigue, dizziness, depression, insomnia, nightmares, GI upset, erectile dysfunction, dyspnea, and wheezing. Warning: when stopping therapy, taper dosage over 1 to 2 weeks because abrupt discontinuation may cause chest pain or MI. Patient education. Patients should be compliant with medication therapy and take the medication at the same time each day. Do not abruptly cease medication as arrhythmias, hypertension, or ischemia may develop. Patients and families should be instructed to check pulse and blood pressure and report abnormalities to the healthcare provider. Additionally, these medications may cause side effects of dizziness and cold sensitivity. ACE inhibitor or angiotensin converting enzyme. Captopril. Captopril is an example of an ACE inhibitor. Mechanism of action. This medication blocks the conversion of angiotensin 1 to angiotensin 2 in the renin-angiotensin-aldosterone system. This will lead to vasodilation and sodium and water excretion by blocking aldosterone. Indications for use. Captopril is used to treat hypertension and heart failure. This medication also helps reduce diabetic nephropathy. Considerations. Do not administer to patients who are pregnant. Use with caution with patients who have diabetes. Avoid use with other medications that increase potassium. This medication may increase risk for lithium toxicity. Adverse effects. Warning. Patients who become pregnant should discontinue this medication due to the risk of fetal harm or death. Patients taking this medication may experience hypotension, cough, hyperkalemia, increased risk for infection, angioedema, anaphylactoid reactions, or proteinuria. Patients who experience increased facial swelling or difficulty swallowing or breathing should seek emergency medical attention. Report a persistent cough or angioedema to a healthcare provider. Medications should be taken as directed. Patients taking ACE inhibitors should be cautioned to avoid salt substitutes or foods high in potassium. Additionally, the medication may alter the sense of taste, but this generally resolves within 2 to 3 months of medication therapy. Patients taking ACE inhibitors may also experience a persistent cough throughout the duration of medication therapy. Angiotensin 2 receptor blocker, or ARB. Losartan is an example of an angiotensin 2 receptor blocker, also referred to as an ARB. ARBs are similar to ACE inhibitors in that they act on the renin-angiotensin-aldosterone system, or RAS. However, the difference is that they block angiotensin 2 and cause vasodilation and decrease peripheral resistance, but are not likely to cause the cough that ACE inhibitors can. Mechanism of action. Losartan blocks angiotensin 2 in the renin-angiotensin-aldosterone system to produce vasodilation. Indications for use. An ARB is used for treatment of hypertension and to prevent nephropathy in diabetic patients. Considerations. Do not administer to patients who are pregnant. It is not recommended for children under 6. Anticipate doses adjustment with hepatic impairment. This drug can cause renal impairment and hyperkalemia. Warning. Patients who become pregnant should discontinue this medication due to the risk of fetal harm or fetal death. Patients taking this medication may experience hypotension, dizziness, increased risk of infection, angioedema, or proteinuria. Patients who experience increased facial swelling or difficulty swallowing or breathing should seek emergency medical attention. Patient teaching and education. Medications should be taken as directed at the same time each day. Patients should not discontinue therapy unless directed by their healthcare provider. Patients should be careful to avoid salt substitutes and foods with high levels of potassium. ARBs may cause orthostatic changes, and patients should be cautioned to change positions slowly.